Hey guys, Stacy at Easy Acupuncture School, where we take the tangled and untangle them and wrangle you back into a place of understanding. I'm Stacy Hewitt, acupuncturist, 13 years, teacher for 7, part four of patient interaction, how to interact with your patients. And sorry, I had to get off a while ago. I just had a patient call and tell me that the roads are flooded. Like I said, it's a little bit rainy here, and there would be a little late. So so anyway, let's start back. Start back here and where we left off. Here. And then yeah. All right. So treatment. Let me get this out of the way for me at least. Yeah. Oh, there we go. Treatment. Sometimes the patient will say, you might feel a little prick. I like that cartoon. Sometimes they say, I feel the needles. I feel the needles. So what does that mean? So what you need to do is you need to discern whether they're feeling the chi or they're just feeling a needle sensation or if it's painful. Let me give you an example. I've studied both Chinese and Japanese acupuncture, and Chinese acupuncture has a lot of times larger gauge needles and a lot of stimulation because they are really about you patient feeling the da chi and really feeling it. And Japanese is the opposite, where it's tiny needles and you gently tap them in, and the patients didn't feel much. The Chinese feel like if they don't feel anything, you failed. The Japanese feel like if they feel anything, you failed. So I'm kind of in between. So I do very light insertions. Most of the time, if I'm not doing musculoskeletal work, they're not super deep. But then, so I have patients sometimes that they don't feel any of my needles when they go in. And then occasionally they'll feel one, as I'm putting it in, and they're like, well, I don't typically feel anything when you put anything in, and now I'm feeling something. So sometimes when I'm working, this is just me doing my Japanese style acupuncture, it's kind of like I have to discern whether is this painful, or is it this that you don't typically feel anything and you're feeling the normal needle insertion that people typically might feel when they're getting maybe Chinese acupuncture or Chinese style acupuncture. And it's not really painful, it's just that you're not used to feeling anything at all. So one of the things I will tell people, if they're like screaming and hollering, then more than likely they're in pain and we need to adjust stuff. But usually I tell people it's like, is it really, I ask them, is it really painful? If it's not, then what you need to, it's okay. People can experience, and I might be saying exactly what I have on the next slide because I don't remember what I have on the next slide, but I'll say people experience acupuncture in many different ways. As long as it's not painful, you might feel acupressure, the needles as pressure on a point. Sometimes people feel warmth in the area. Sometimes people feel like a little electrical sensation, or sometimes people feel what they call energy in the area collecting. You can experience acupuncture in many different ways. It doesn't matter what you feel, as long as the intensity of what you feel will not keep you from relaxing when I leave the room. If the sensation you're feeling is so intense that you're not going to be able to relax when I leave, I need to adjust it. And if it's painful, I need to adjust it. So that really gives them a definition of like, it's okay to feel something because sometimes we do feel things when we get acupuncture. But make sure it's not pain or it's not so intense, whatever you're feeling, that you won't be able to relax. Could be feeling like you're feeling a tickle monkey on the needles or something, and that's okay. But I don't want it to keep you from relaxing when I leave. So that's one thing you just need to check with them. I mean, and like I said, if it's painful, readjust your needle, reinsert your needle. This is the thing that I just said, just tell them they can experience it in many different ways, but they need to be able to, whatever they're experiencing, it doesn't need to be painful, or they need to be able to relax when you leave. So treatment. If you're doing something in addition to acupuncture, tell them why. Just don't jump on them with some cups or a gua sha tool and start scraping away or suctioning it away. You might be comfortable with it, but they might not be comfortable with it. So let them know what you're doing. Okay. So with gua sha, tell them what you're doing, why you're doing it. It relaxes the muscles and helps the body expel metabolic waste. That's what the discoloration is. Doesn't mean it's coming outside of your skin. It's going to be underneath the skin, but it just helps bring metabolic waste up to the surface and might discolor the area. Always explain there might be discoloration and explain it's not bruising because people will get confused. They'll leave your office and then somebody will see their washad shoulder and be like, "What did they do to you? Why are you all bruised up? Did they beat you?" And then they won't be able to explain really well to their partner, friend, whoever who sees it. And then you're going to be, known as the bruiser or something like that. But just let them know. And also be mindful that you're not doing it too hard and you really are bruising them. I mean, it's I've had patients come in, um, more so this would be in cupping, where I've explained to people what cupping's about, and I get ready to do it, and they're like, I don't want to do it because I had this other PT to do some cupping on me, and it really, really hurt, and it bruised me, and I was bruised for a long time. And I'm just too nervous. And then it goes back to what we talked about before. Don't force a treatment on somebody that they don't want, because then it's going to make it not work. Um, but explain what the discoloration or the patina marks are with gua sha, what it's doing, why it's doing it. Same thing with cupping. This is what I say, cupping. When I've talked to people, I always say, "Have you ever been cupped before?" But then we probably, if it's for a lot of times with musculoskeletal stuff, I will cup people. And if you haven't been cupped before, let me talk to you a little bit about it. Cupping, you've probably seen some of the cupping marks, discolorations in the Olympics. A lot of times the Olympic swimmers will have those circles on their back that are discolored. And people get a little confused sometimes and think that cups leave bruises, but there's a difference between bruising and the discoloration that you receive with cupping. Because if you have a bruise on your arm and you push on it, it hurts, right? But you can push on an area that's been cupped, that's discolored, and typically it should not hurt because you can push on that discolored area, and you can push on the area that's right beside it, and they feel the same. Unlike a bruise, ouch, that hurts, and then you push beside it and it doesn't hurt. So that's the difference. It's a discoloration. And once again, cupping is all about it modulates the muscles to relax, it increases blood flow to the area, and that increased blood flow helps reduce inflammation. Um, so what that discoloration is when it provides all that suction, is pulling metabolic waste out of the tissue and is putting it towards a more superficial level of the tissue where it can more easily be washed out. So that's what's happening. If you get any discolorations, that's what they are. They're not bruises, they're discolorations. Also, and somewhere, I don't remember if it's in this lecture because I haven't talked about it yet, or if it's in another one. Once again, with any of the stuff, if there's you make a note if there's any spots that their body doesn't like cupping, is sore or uncomfortable or gua sha'd, make a mental note. So next time, if you do it, If it happens again, readjust your treatment. But if there are areas that show up really dark on people, I will let them know ahead of time. And for some reason, well, it's because of the repetitive use. I think that's at least my theory. I haven't seen it in any books, but for some reason, when you cup, especially the interior part of the shoulder, it will turn black as night. I mean, it's not uncommon for that to leave a big cupping mark or discoloration. And I always warn people if it's the first time I've cupped their shoulders, or, maybe if it's not the first time, or if I haven't cupped them in a while up here, I'll say, hey, just to let you know that this area is it's very common for anybody to get a really dark circle up here. So just to let you know, so you don't see it and freak out about it. So just to let you know. And most people are fine with it. Plus, it lets tell them about the cupping discolorations, so they don't get off the table and be like, "Oh my God, what did you do to my back? I've got all these marks on there, and I'm getting ready to go to a wedding with a backless dress." Just to make sure. And most of the time, people don't have any issues with it, but you just want to make sure that they know what you're doing. And also you can talk to them about it. Typically, cupping marks might last for 2 to 5 days, and that's okay. It's okay. Usually, the darker they are or the longer they last means the more you need it in that area. So just tell them what you're doing. Let's see the cupping marks. This is going over just what I talked about, the discolorations. Roughly 2 to 5 days. Make sure they're not going to a wedding. If you're cupping an area, look at that. I was about the anterior shoulder, warned them about it might get really dark. So we've already covered all of this. Leaving the room. So you've got all the needles in, you've treated them, you're leaving the room. Give them a bell. We talked about the bell. And just say, don't hesitate to ring this if you need me. I'm right outside the door, updating your chart. I'll sometimes jokingly say, and if you ring this bell, I'll be like a genie, poof, appear. So just ring the bell if you need me. Ring the bell. Don't hesitate. That's what it's there for. Oops, wrong way, sorry. And then say, also just check to make sure, are all the needles comfortable for you? Because you don't want to come back in and they're like, this needle's been bothering me the whole time. Because once again, they won't have relaxed. Treatment probably won't work as well because they're not in a parasympathetic state. And then you'll be known forever. You'll always bring it up about that needle that was uncomfortable for them 3 years ago. They won't forget that. It'll be like an elephant. Elephants are supposed to have this superior memory that they can remember things forever. They'll be like that. Or if you don't explain to them about cupping marks, then what will happen is you will get a call from them, 1 or 2 days later, or probably that day, to make sure this is okay. Their partner just saw them, or they looked at themselves in the mirror and they weren't expecting it. They don't know what's going on. They will call you, and then they will bring that up. Remember 5 years ago when you cut me and I had those big brown spots on my back? They will bring it up. They will never forget that stuff. So just inform them before you do it. So while you're leaving the room, make sure the needles are comfortable for them. And then while you're needling, I wish I'd looked this up because I'm going to do this other series on the Tao Te Ching and acupuncture. But there's one passage in there, and I don't remember which chapter it is, but it talks about something about like men or soldiers crossing the ice, and how they have to be very observant and alert. And when you're needling, it's the same way. It's like you want to be very observant and alert, because with every needle you put in, if there's a change in a person's breath, if you see their musculature move slightly, their eyes look around, like they're like looking like, what the heck's going on? check in with them and say, hey, is that needle okay? Any movement, any sympathetic feedback you get from a person's body, like meaning if they move around, their body twitches, they breathe, exhale, you see them looking around, with their eyes, anything. Check in with them to make sure that needle was okay. Because not everybody's going to like, if you have a needle that's uncomfortable, it's going to start screaming and hollering. Ah, that's crazy. That hurts. They're not with every needle. So just check in. It makes them know that you're concerned about how they are, how they're doing. You want them to be comfortable. And then also for me, while I'm needling, I usually check in as well. Like after I get about 6 to 8 needles in, I'll ask, hey, are all those needles okay for you? Even if I don't sense anything or see anything or detect anything, I always will, after I get a few in, just be like, oh, are all those okay for you so far? Usually they'll be, yeah. Or if they're not, then I just need to adjust or reinsert. Also, ask them about the temperature because once people start to get further in there into the parasympathetic system, their body starts to cool off. So they might come in and they're all hot and bothered when they come in, right? Because of the temperature or trying to find a parking space or whatever. They get in here and they're like, I'm hot. But as soon as they get on the table and you get some needles in them and they start to relax, then they get chilly. So it's not uncommon for people to get cool when they relax. So check to make sure that the temperature is okay as you're leaving the room. But you don't want them to be already cold. I mean, I use a TDP lamp and I'll probably have a little mini episode about the TDP lamps. I love them because not only do they help circulation and help with putting energy into the body, it just feels good. It keeps people warm. And so I use those to keep them warm. If you're doing a two-sided treatment with someone, um, check with them to make sure once you flip them over, they're still comfortable. The needles were okay and the temperature's okay, but you don't want them to be cold. Returning to the room. And so when you return to the room, I jokingly say paradise is over because people are like, oh no, I'm coming back to reality now. I've got to, get back to my job. I've got to get back to real life. And so that's paradise is over. Oh. So when you're returning to the room, you always ask, how are you doing? Did you get to relax a little bit? And you're just asking that because sure you care, but you want to make sure that there wasn't an issue with any of the treatment, like anything was, you know, brought up, emotionally brought up, and they were the whole time uncomfortable, or there was a needle that was uncomfortable. Occasionally, um, so I always will say, "How are you doing? Were you able to relax?" That kind of sums up if they were like, "Oh yeah, I was able to relax." That answers all those questions, right? Then also ask them about the temperature. Were you comfortable the whole time? Because that just for the future, if they got too cold, then I've got a little space heater in my room that I only use during the winter time. But if they were cold, I can turn that on for them. I don't mind. Because I want them temperature wise to feel comfortable. I took a Japanese acupuncture class one time and the guy was all about covering them in these towels, keeping them covered everywhere to keep them warm. But just make sure that they were okay temperature wise and needle wise. And then also too, look at what their demeanor is like. And I don't know if I can't remember if it's in this lecture or not, or if I have it in another lecture, but every once in a while, you'll have somebody that as soon as you open the door, their eyes are like saucers. They're like wide open and they're like vigilant. Like, and you can tell that they probably didn't relax. And then you can talk to them more about, was it the temperature, the needles, or sometimes people just aren't used to just shutting their mind off for just a little bit. So then you can start to work with them on the next session, start introducing some maybe breathing techniques, some things to help them realize, help their body to integrate with the relaxation response that's that happens with acupuncture. Because like I said, sometimes when we start getting that relaxation response, our body doesn't know what to do with it. So then it stresses, makes them more vigilant, makes them like hyper, like awake. Um, or sometimes people just aren't used to taking a space for themselves. So it's kind of training them how to do that, how to do that comfortably. So, just pay attention to their demeanor. If you open the door gently and they're like, look like they're on guard duty, then there's some things to talk about to help them next time around. If they're faced down, and this is just me, I haven't read this anywhere, but this is just me. If they're face down, speak to them before you take any needles out, so they can hear your voice and know it's you, and not some psycho like this guy at the bottom that just broke into the room. I always feel like I need to say, "Hey, how are you doing?" before I take anything out, so they know it's me coming in the room. I mean, they can't see because they're face down. They don't know what's going on. So let them know that they're still safe and you're there, and say, "Hey, I'm getting ready to take the needles out," or if it's especially if it's their first time. Also, I don't have this in here because I just thought of it, but two, when you step out of the room, this would be for a ways back when we were talking about leaving the room when their treatment starts. If this is the first time they've had acupuncture, you give them a bell, you tell them, yeah, you'll be, depending on how much time you have to give them, you'll be in here for maybe 15 to 20 minutes. And then I'll come back in and take the needles out. And if you're going to treat them on the other side, you tell them you're going to flip them, or you just tell them how much time they're going to be on the table if they don't know. So and so they don't feel like they're supposed to. So I know some practitioners do this. I don't do this. If you do this, that's fine too. But sometimes there will be practitioners that I've trained with that say that they leave the person on the table for 40 minutes to an hour. Um, okay. Um, but just let them know that how much time they're going to lay on there, and let them know, even though you've given them a bell, they don't have to ring that to have you come back in to finish the treatment, or let you know that they're done. I mean, I some have some patients that cook a little quicker, and maybe after 10 minutes they're done. They'll ring the bell and that's fine. But I do have some patients that are every once in a while will ask me, "Am I supposed to ring the bell to let you know when to come back in?" And I'm like, "No, you just need to ring the bell if there's something that's going on that you need me to address." Um, but you're just going to be on here for maybe 20 minutes, and that's fine. But don't let them know that. I mean, don't let them feel like they're the ones who have to let you know when to come back in for the treatment to be over, unless they need of course, if they need the treatment over early or something like that. um so anyway, yeah, let you know that you're getting ready to take them out if they're face down, and you're you and not this crazy guy at the bottom of the screen. And then ask them, how are they doing, because you want to know if there was any problems. How are things going? Because 5.5% of the patients you see in your lifetime uh, might have an issue but won't ring the bell. So that's why you ask, how are all the needles? Because occasionally somebody still, even though you told them no pain, no gain, it's not what we were after, they feel like they have to suffer through it. They have to suffer through something for it to work. So you just need to make sure that everything was okay for them. And if not, next time you need to adjust or to be aware of it, so you can modify your treatment. Okay, guys, I hate to do this once again, but I've got to stop because I've got another patient. But anyway, we'll get back to this, and hopefully next time we will finish this out. Sorry to be so many clips, so short and so frequent clips, but I'm just having to run through patients. But like, subscribe to my newsletter, subscribe to my channel, and I will see you soon. Okay. Hey guys, I'm hoping that I'm trying something new where just pause the recording for a bit. I'm hoping that it's recording, but we'll see. Okay. Oh, well, you know what? I'm gonna stop this. 'Cause I don't know what's going on.